Hello everyone, my name is Ugo and I'm here to present to you my campaign paper titled The Ebola Virus, Halting its Spread in Lagos State, Nigeria. For most of 2014, the Ebola virus has been running wild in Western Africa. This is not surprising because open borders and increases in global trade have resulted in many diseases spreading further than ever before. In addition, drug-resistant diseases have become a recurring theme. This is worsened by growing urban populations where income disparities and sanitation challenges have resulted in diseases having a greater social impact. Here are the economic implications of Ebola. Lagos State is Nigeria's commercial nerve center, and it has the largest urban population in the country, which is even more than many West African countries. Containing and eliminating the Ebola problem here is vital. Doctors, the media, public and private organizations, health administrators, and community groups are key partners in this effort, and they have to be briefed on what is going on. To stem the spread of the disease, the state government will launch public sensitization campaigns to create massive awareness of what we face. Ideally, our strategy would require that we create a plan which is endorsed by stakeholders within the state. However, this is not the time for consultation. We must act in a manner that is acceptable to all. In communicating the risk at hand, we must restate our goal of halting the spread of the Ebola virus and treating those who are infected. Proposed awareness campaigns will be launched to explain how it started, describe the nature of the Ebola disease, its mode of transmission, how different stakeholders are at risk, and how anyone or everyone can minimize the risk of new infections. Tackling these tasks head on and carrying stakeholders along will help to eliminate widespread inaccuracies and rumors that usually take root in these type of situations.
Without any certainty of effective treatment, people are running in all kinds of directions. We need to set up centers in every village, in every urban slum, in the hospitals, where people understand how to prevent the spread of the disease and also how to treat it. The message is really, really clear. We've got to have a massive, complete response as quickly as possible. Speed is of the essence, and comprehensiveness is of the essence. We cannot afford to wait a day longer. We've got to get moving. We've got to get moving right now.
A state crisis coordinating center must be established with local units created in each of the 20 local government areas of the state. These are county equivalents. This is vital because we must coordinate the information release statewide. An information vetting process shall be established with designated spokespeople selected. The development of communication materials will begin, and we will partner with traditional media organizations while activating those social media platforms we believe are the most relevant for our communication efforts. We are dealing with a full-blown crisis, and so members of the public and information teams we partner with will have duties set as well. We have never faced this type of problem before, and so round-the-clock outreach is important, and contact details for key partners and access to tech resources is vital.
I'd ever experienced. It was a bit like a flu in the sense that there was body aches and chills and fever, but they were so pronounced and so much more intense than anything that you're likely to get with a flu, unless it's a terrible flu that lands you in the ICU. That it would be hard for me to say, did you feel this way once? Well, this is what Ebola is like. It's definitely different.
Our immediate strategy will be as follows. We will officially brief Health System Board and management, employees, and the public. We will identify, interview, and monitor infected people. Face-to-face visits will be conducted by state investigators to families of victims and others at risk. We will draft a statement on the position of the state government, include the facts of the situation, and distribute the statement to journalists, partners, and government officials. These are influencers who can shape discourse on the matter. We will prepare a press release with essential facts and background details and utilize confirmed figures. This is important because presenting the facts of the matter is good for clarity. We will hold a press conference to brief the media on the incident and push for added coverage of the event. There is nothing to hide and this must be demonstrated. We will use social media to further distribute and elaborate on the government statement and press release. People can make comments and ask questions here as well as receive responses. We will set up a media center and designate contact points for inquiries, including online. Telephone and email contact points must function and be monitored daily. For this purpose, 24-hour shifts will be set up to manage the flow of information. In addition to being courteous and patient with the media, phone calls will be returned speedily. We will monitor news and other online reports in order to identify and correct inaccuracies. We will keep a log record of responses to journalists and target audiences for evaluation and reference purposes. We will routinely update all information pertaining to the incident, and all state government websites and social media channels will have this information contained. Transparency is critical. Already, some people claim that Ebola is part of a government conspiracy.
What's Ebola and how dangerous is it?
Ebola is a virus. It's what we call a hemorrhagic fever virus. So it causes high fever, it causes bleeding, and it's a virus that's found in Africa, usually in bats, and then spreads to people. It's a highly lethal virus when it gets into a person, with 50 or 60% of such people dying once they develop symptoms.
Our key messages for everyone are as follows. Wash hands frequently or use an alcohol-based hand sanitizer. Avoid contact with blood and bodily fluids of any person, particularly someone who is sick, and do not touch the body of someone who has died from Ebola. Do not handle items that may have come in contact with an infected person's blood or bodily fluids. Do not touch bats and non-human primates or their blood and fluids and do not touch or eat raw meat prepared from these animals. Seek medical care immediately, especially if you develop a fever, temperature of 100.4 degrees Fahrenheit or 38.0 degrees Celsius or higher, and any of the following symptoms: headache, muscle pain, diarrhea, vomiting, stomach ache, or unexplained bruising or bleeding. Limit your contact with others and do not travel anywhere besides a healthcare facility.
How does Ebola spread?
Well, once people develop symptoms, the virus is in various bodily fluids. It's in blood, it's in vomit, it's in diarrhea. We think it can be in tears or in saliva or in sweat. So the virus is spread through direct contact with an ill individual with Ebola, and contact with their bodily fluids, or sometimes direct contact with the body while the person is alive or while preparing the body for burial.
Our overall goals will entail doing the following. Properly inform all stakeholders of what happened and what steps are being taken to resolve the problem. This entails utilizing every possible channel already listed. The state government must accept some measure of responsibility and mention that steps are being taken to address the matter. Naturally, we will focus on positive steps being taken. We will express care and concern for the victims and their families. We will acknowledge everyone's fear and concern by listening and recognizing the people going through them. Repeating apologies is good. We must offer reassurances of corrective steps, but will avoid making promises that cannot be kept. We may highlight steps the government will take to address the incident, while working to prevent similar events from occurring in the future. And finally, the best aspect of this project will be the implementation phase. This is where all the theory one learns will meet practical functions and will either make or mar the entire effort. Overall, we'll kick things off by doing the following. We're going to draw up a statement for the state governor to issue and use it to influence the emotions of stakeholders and outline possible resolution steps going forward. It is the norm in today's world to apologize when something bad happens, whether or not you're the cause of it happening. 2. We're going to distribute the statement to state workers and officials. The staff are our primary constituents and ambassadors. They are the frontline workers to lead our containment and eradication efforts. And 3. We will circulate information on the positive contributions the state government has made in relation to healthcare over time. This will be made available on all government websites, via social media, and to the press. The state government needs to be viewed favorably by the public to foster cooperation. Reminding stakeholders of good things done in the past while taking corrective action goes a long way. Making a pledge to review infectious diseases safety standards are valuable too. Thank you very much. Bye-bye.